Doctor, you've talked about nightshades before, and you'll have to refresh me on what exactly they are, but if my recollection of they're vegetables, which again, most people would think are healthy. Not the case necessarily?
Well, it's not that they're not healthy, and it's really a great question because some of the nightshades are part of people's, their passion. And I'm going to tell you a little secret about nightshades. Nightshades happen to be tomatoes, potatoes, eggplant, and green pepper. They are not bad foods, but they have something in them called solanin. Solanin happens to be an alkaloid toxin that if you have liver distress, it comes back to that liver all the time. This happens to be an oil filter. It's the liver in your body. If you happen to have liver distress, tomatoes, potatoes, eggplant, and green pepper can cause distress. I also want to point out to individuals that the green pepper, if you have digestive distress with green pepper, you probably have liver gallbladder distress also. That's really significant for people. Now, we have a lot of different abilities and ways to test patients in our practice, and one of them happens to be through a galvanic skin response. It's biocommunication testing, and we could do a food stressor. So that means electronically, we can literally test somebody. So when we had the first version of this apparatus, cigarettes were showing up, nicotine was showing up, and I just happened to have a lot of faith-based people coming into my practice, and they just said, Dr. Bob, I don't smoke. I don't smoke. And I just thought, okay, you don't smoke. But it was happening over and over again. So this is like, it was good, but it wasn't giving me exactly what's going on. So I thought, I am going to go to the internet, and I am going to type up foods with nicotine. And guess what showed up? The nightshades. Tomatoes, potatoes, eggplant, and green pepper. So let's say someone's going to quit smoking. They start to have an addiction to white potatoes, or they love pasta. So a lot of these so-called comfort foods, physiologically, people want it because of the nicotine. That was very profound to me. But I also have learned over time, and we've talked about this in a prior segment, about gluten-free. Many times they'll replace the gluten with potato starch. So if you are eating gluten-free food and your mid-back starts to hurt you, because by the way, BTW, nightshades usually cause pain once again in the mid-back region. If your mid-back starts to bother you and you've gone gluten-free, it could be the potato starch. If you have potato chips and potato salad and french fries and au gratin potatoes and double baked potatoes and your mid-back is relentlessly bothering you, lay off of them. I would rather have you have squash, butternut squash, acorn squash. Squash is a great alternative. Sweet potatoes, yams. You can go on the wild side. You cut a yam in half, bake it in the oven, throw a little cinnamon on it, throw a few sprinkles of walnuts. Does the body good.